Hi everybody, today I'm going to be reviewing how to do a melanoma assessment. As nurses, we may not do these as frequently. There is a doctor called a dermatologist that specifies and practices in the realm of skin and doing these types of assessment, but it's always good to know how to do one, whether that be to educate your patient on how to do a self-examination or even to examine yourself. So this is just something to have in the back pocket in case it may come up. To remember how to assess a mole, we use our A, B, C, D, and E acronym. A stands for asymmetrical, B stands for border, C stands for color, D for diameter, and E for evolution. Starting with A, we're going to look at if our mole is symmetrical or asymmetrical. The goal is to have it be symmetrical. So looking at these two moles here, if you were to draw a line down the middle, it's somewhat symmetrical, but compared to this mole, I would say that this one is definitely asymmetrical. And this one over here on the right, that's definitely asymmetrical. So that's something that we're going to be looking for that could be concerning. Our next part of the acronym, B, is border. Is the border defined or not? You can see in this picture that there is a well-defined border. But in the picture on the right, its comparison, the border is kind of different from here over to here. The border is not well defined. And if the border is not well defined, that's also a potential red flag for a mole that might be a potential risk for melanoma. C, color. We want an even color distribution. Sometimes even a fully dark mole can be a concern, but we're more concerned with discoloration. So on both of these moles here, you can see that this color and this color are two different colors in the same mole. Same thing with this. There is a darker portion in the mole than there is in the entirety. So that's also concerning. D stands for diameter. We don't want our moles to be too big. We want our moles to be 6 millimeters or 1/4 of an inch or smaller. And that is the tip of a pencil eraser. So that can be something that you keep in your pocket, or if you can just have that in a memory. We all know about the size of the tip of a pencil eraser. So just know that anything above that might be a red flag. You'll also see a lot of dermatologists carry around rulers and that way they can actually measure and record the size of the mole, because our next part of the acronym is evolution. We do not want these moles evolving. Evolution can indicate a big melanoma flag. So evolution can occur in size, color change, things like that. And you can see here in this example, the mole starts out very small and slowly gets bigger. And you can even see too that the color distribution in the border is also changing. That wraps it up for a quick melanoma assessment. Don't forget to like and subscribe.